Hello guys, welcome back to Clinically Clear. So today let's cover a short but extremely important topic, that is planning cycle. So what is planning cycle? Whenever we are coming up with a health plan, it could be an health policy, a national health program, whatever it is, the cycle, how we come up with that health plan and how we implement it, that is known as planning cycle. So first of all, before we plan something, we need to know what is the health situation that is already there in that given area. So analyzing the health situation by collecting, first we collect all the health related data. We collect the epidemiology of diseases, the population demography, the geographical distribution, the morbidity, the mortality rates, the hospitals, the number of hospitals in that area, the number of doctors, nurses, the manpower. So all the health related data, we'll collect it, we'll tabulate it, we'll interpret it, and then we'll come up with a health need of a population. Every population will have health needs. In some areas it could be a different need, in some areas it could be a different need. So by analyzing the health situation, we are coming up with the health need of that population, understood, by collecting all the health related data. Then we'll establish goals. The goals depend on the manpower, the amount of time you have, the amount of resources. You can't have unrealistic goals. It has to be realistic. And at each organization level, you should have a goal. That is important. Example, in national health program, you'll have national level, state level, district level, community level, village level. So at each organization level, you should have a goal. And the lower you go, that is the more you go towards district level and community level, you have more specific goals, and the upper levels of the organization, you'll have more of vague goals. For example, at national level, you'll have just a goal like overall implementation of program, whereas at community level, at village level, you'll have like a screening test, you'll have to do these many number of tests, all that stuff. The goals are more specific. The main point of having goals is to prevent the wastage of funds and time. If you don't have goals, what are you even doing? Like, you're just randomly wasting time, wasting funds, simply doing, there's no systematic structure. So that is why you have goals at each organization level. Then coming to the assessment of resources available, you will have, there are multiple resources, not just money, the manpower, the raw material, the skills, the technique and the knowledge. Having just manpower is not sufficient. The manpower you have, they should know, they should have knowledge, they should have the technique, they should have enough skill to implement the health plan. And of course, money, raw material also are important. So you'll establish multiple goals, you'll assess the amount of resources you have available. Then you have to prioritize some goals over the other. See, the total amount of resources available will always be less than the resources needed to meet all the needs of the population. See, all the health needs of the population cannot be met because you simply don't have that many resources. So you have to prioritize some health needs over the other. How will you do this prioritization? You will do it based on whichever diseases can be prevented at a low cost, you will prioritize. Whichever disease, if you prevent, you will end up saving more of the younger population, you will prioritize. You always prioritize the young population over the old population. And political interests also. Example, some political party would have promised in their manifesto to get rid of a certain disease. Then your health plan will also prioritize that disease because political interests come into the picture. So prioritization you will do. Prioritize one of the health needs. Then for that health need, for that goal, you will come up with a written plan. That written plan will have everything. It will have the resources needed, the goals, the manpower needed, the time needed for each stage, the expected outcome of that health plan, and an inbuilt evaluation system. That is, the health plan will have a system in place to evaluate its own outcome, like how is the health plan doing, is it successful, is it a failure. So you should have an inbuilt evaluation system. You should have, the written plan should have the expected outcome, the time at each stage, the money at each stage, the manpower, the resources, the goals, everything in detail. You will submit a written plan to the government. The government, if they choose your health plan, then you have to start implementation. Now, for the implementation to be successful, it depends on many things. Example, you should have a good organizational setup where at each level of the organization, each individual has set roles and set tasks. If your organizational setup is good and at each level you have individuals who know their role, who know their tasks, then the implementation will be successful. And you have to also select this, you have to do selection of the staff basically the healthcare workers, you have to train them and you have to supervise them. So you have to select competent workers, you have to train them so that they can implement the health plan, and you have to supervise them so that the implementation keeps continuing in the good way. Okay, so these are some factors affecting the health plan implementation. Next, coming to monitoring and evaluation. So monitoring is, you will do day-to-day observation, recording, reporting of activities during implementation. That is, when you are doing this implementation of the health plan, when you're implementing the health plan, you will observe, you'll record, you'll report any events or anything that you feel like is important. You will report it during implementation. The whole point of monitoring is basically supervision. The whole point is so that everything is following time schedule, everything is going according to schedule, it's not getting postponed or it's not getting delayed, and everything is taking place correctly. We don't want to implement the health plan in the wrong manner, right? It should be how it is intended to be. So monitoring is done. Then coming to evaluation mainly, you to check the evaluation is after implementation. You'll implement the health plan and then you'll evaluate how it is doing. Has it fulfilled the goals and objective or not? It is to check the degree of fulfillment of goals and objective. It assesses the outcome. Whether you have met the expected outcome or not is through evaluation, to check how much have you fulfilled the original goals of the health plan. I told you a good health plan will have inbuilt indicators and an inbuilt evaluation system to check the degree of fulfillment. Understood? So after that, you've implemented the health plan. Now you'll once again analyze to see if there are any more new health needs of a population. Understood? So analyzing the health population, analyzing the health situation, you'll collect health related data, you'll find the health needs of the population. Then establish goals at each organization level, realistic goals. More higher it is vague, more lower it is more specific goal. Assess the amount of resources, money, manpower, technique, knowledge, everything. Prioritize the goals based on some criteria, like younger people you want to save, low cost you want to save. Submit a written plan with all the required information like time, money, manpower, evaluation system, expected outcome, etc. Implement the health plan, which depends on selection of workers, training of workers, supervision of worker, the organization, the tasks and the roles, and monitor the health plan day-to-day recording, observation and reporting of activities so that everything is running correctly, everything is running smoothly, and after the program is implemented, evaluate it whether it fulfilled the goals and objectives or not. This is, if a good health plan, a good national health program, a good health plan will have inbuilt indicators and evaluation system. That's it for planning cycle. Thank you for watching.